everybody. 12 seconds. It takes 12 seconds to potentially get interrupted at the doctor's office. Have you ever felt really rushed when you're at the doctor's or you're with your practitioner? Or have you ever felt kind of crazy, like they made you feel like you were crazy? Yeah, you're not alone. It's actually pretty common, and I've been there too. There's a study done that the average amount of time to get interrupted at the doctor's is around 12 seconds. You know, I never realized this before. I've been to the doctor's. I've probably felt rushed. I also am a mom who gets interrupted all the time. And I used to be a high school teacher who gets interrupted all the time. But it's much different when you are a client. You should not be getting interrupted because the story is the most important part. I'm going to talk about that today. I'm not anti-doctor, demonizing doctors. I don't want you guys to misunderstand me. I just want you to understand that that is the information and the facts of what is going on. And so you need to know those things in order to be able to advocate for yourself and get the care that you deserve. So you need to be aware for that being interrupted. Validate your feelings. If you're feeling rushed, it's not because you're sensitive or because, I don't know, it's because, you deserve better. So there's something called a diagnostic tree. And I was talking about this when I was talking with Amy from restoringvenus.com, which I'm going to reference a little bit later. And she was saying how there is a diagnostic tree that doctors and practitioners use. And, this doesn't work, then we go to the next thing. This doesn't work, then we go to the next thing. But they do that without a lot of critical thinking, without looking at the human as a human with a story versus a body and biomechanics. And they don't work often in that gray area. And again, I'm telling you this because I want you to be able to advocate for yourself and not get stuck in that diagnostic tree. Not get stuck without someone that's going to really use that critical thinking. Look past just the biomechanics. I can't tell you how many clients I've had come to me and I really feel like I was the first person to actually listen to them. And I'm not tooting my own horn. I mean, my process is I send them a list of questions, they fill them out. So I get some background, they come in, they start talking, and I don't interrupt them. That's it. But I can see that this is the first time that this has really happened to them. And then I start hearing them giving me gifts, is how Anthony Lowe talks about it. Giving me gifts of things that I can start piecing together to hopefully help them on their healing journey. It's really powerful. But it's also really sad that I, at the gym as a coach, am like the first person to really get it. It's unbelievable. It is our job as coaches, doctors, physical therapists, practitioners of any kind to listen and interpret your story. What beliefs are you coming to us with? Is it something others, doctors or coaches or people have told you? Is it pain somewhere in your body, even though the scan shows that you're fine? It is our job to use critical thinking and interpret what is going on with your story. That's what quality care is, and I want you to know that that is a reality, and it's out there. Your feelings are valid, my clients' feelings are valid, and my feelings were valid on my journey. I want you to find help sooner than I did and sooner than a lot of people that I know. If you guys are interested in learning more about this topic, I highly recommend restoringvenus.com. Amy is coming out with her memoir this month, March 2019, about her 17 to 18 years of pain, a surgery she probably didn't need, and how she finally got out of that circle. It is the most powerful thing you will ever read, I promise you, and it has changed me. Check it out. My PT Education is where you can go if you're a PT or a Fit Pro and you want to learn more about the biopsychosocial model and how to help your clients, put on by Anthony Lowe. And then there's also the Women's Health Podcast Anthony hosts, and that will interview some of the top women in the women's health field. And you can learn a lot there too. Okay, just remember, if you're not feeling heard, if you feel like you're crazy, any of those things, find someone new to work with. I promise you there's a whole nother world out there that can actually help you. Do not give up. Don't stop advocating for yourself. Don't let anyone make you feel like you're crazy. Thanks, guys.